and I would officially be starting the session. Good morning, good afternoon, good evening, depending on where you're joining in from. You're welcome to yet another Pharma Tech class session. And today I can see we already have 54 participants in the room. Before now, we have over 300 registrations for this particular session. So trust me, it's a much needed conversation. We're hoping it will spark the necessary action to curtail the outbreak of this, re-emerging and emerging diseases, transboundary diseases, and generally to also mitigate this One Health related problems, challenges that keep coming up. Thank you so much for joining. I am Dr. Tumsia Maimunaman Isa, the Community Engagement Manager for Pharmalat, and I will be facilitating the session for today alongside Dr. Akambi Bolale. She will be co-facilitating, and today we're going to have Dr. Kayode Femi, who is the CEO of Pharmalat Limited, and he will be moderating the participatory session. I can see our hub experts already in the room. We have Dr. Professor Folorunsho Fashina. I can also see Mr. Peter Arwen joining in from Ghana. I would acknowledge other hub experts as soon as your name pops up on the screen. And other than discussing anthrax outbreak, the story, the impact, and also the lessons that veterinarians need to learn in West Africa, we're also going to, at the end of this session, we're going to settle this running battle between Nigeria and Ghana jollof rice. I'll make sure I create time from the agenda. We'll settle it finally today, and that is it. After this, there is no argument about Nigerian and Ghana jollof rice. That's on a lighter note. So permit me to share my screen so I can take us through the agenda. Let's all have an idea of what the session is going to look like and what we have in store for you all today. So let me start sharing my screen. Let me know if you can see my screen. Okay, I think, let me do this. It's easier this way. Few seconds, please. Okay, I'll just be back. I'll be right back up. Okay, let me bring it up now. Sorry. Okay. I should be able to do that now. Please let me know if you can see my screen. Let's see, okay. Please let me know if you can see my screen. I can see it from my end here, so I hope everyone else can also. Okay, so this is, our topic for today is going to be anthrax outbreak in Ghana, the story, impact, and lessons for veterinarians in West Africa. And I hope that other veterinarians from other parts of the world are also in the room, and we're all going to take lessons from the recent outbreak in Ghana. And particularly, I was full of anxiety and fear when I heard of the confirmed cases of anthrax in Ghana. And I told myself, God, I just want to know anthrax in my book. I'm not sure if I want to handle it physically. But as a veterinarian and as a One Health enthusiast, we all have to wake up to our responsibility collectively to manage, to prevent these things from even happening in the first place. So I know it's going to be, and I'm sure you saw the flyer. We have the president of the Veterinary Council of Nigeria. We have the director of the Veterinary Directorate Services of Ghana. We have the Chief Veterinary Officer of Nigeria. We have Professor Fashina, who recently got promoted as the global coordinator for One Health and I think epidemic, let me not mix up the portfolio, but he recently got promoted to a global coordinator for One Health, and I'll remember that along the line. And we also have Peter Arwen, who is the CEO and co-founder of CowTribe. CowTribe, it's a social enterprise domiciled in Ghana. So we'll have a combination of experts today who will, we're going to have an extensive discussion on this topic. So this is just, the logos of our partners. So the TECLA basically stands for Teleeducation for Clinicians in Africa, and where it's a partnership between, this listed organizations. We have Farmalat, we have MDoc, we have Boehringer Ingelheim, Making More Health, and of course, Ashoka Africa. So this is the agenda, introductions, which I am already doing. We'll take a brief about Farmalat by Dr. Akambi Bonale, a brief about Project TECLA. Then we take a pre-quiz. For those of us who are familiar with our sessions, this pre-quiz are just simple set of questions extracted from the presentation, which we administer to our participants to help us gauge knowledge before and after the presentation. And then we delve in straight into the didactic presentation for 25 minutes by none other person than Professor Folorunsho Fashina. So here is the title, Global Coordinator, One Health Epidemic Intelligence and Early Warning, FAO headquarters in Rome. And of course, would have our participatory session for 40 minutes, which will be moderated by Dr. Kayode Femi. So here we're going to be taking questions, answers. You can also share your thoughts and comments with us. And then we'll also take our experts' recommendation on this topic. And then we take a post-quiz. So the post-quiz is the same set of questions you answered during the pre-quiz. However, we're expecting that you answer it differently because you have been exposed to more knowledge and information. So we take that for another 5 minutes. We take announcement and next steps, and then we call it a day. So this entire session is, the duration is 90 minutes, but I know we'll spend more than 90 minutes because there's a lot. We'll try as much as possible to stay within the time allotted, but we have a lot of discussions to do. Since we're here today, why don't we just go ahead and do it? So Dr. Bolale Akambi, before I call you, let me just give an overview of the 4 ECHO pillars. So the Project TECLA leverages the ECHO model. And this ECHO model stands, is structured around these 4 pillars, using video conference technology to leverage scarce healthcare resources, which we're doing here today, specialists sharing best practices with colleagues, case-based learning, and continuous monitoring of program outcomes. So please take note, Project TECLA Africa leverages the ECHO model. So we collect registration, participation questions and answers, and then poll responses for our program. Your information is kept confidential and handled by authorized personnel, so you're safe. So we use this data. It may be used for reports, maps, surveys, quality assurance, evaluation, research, and to also inform new initiatives. This session is being recorded, and we will be sharing a PDF version of the slides after the session, and also not just the PDF version, but the recording of the session via the email you registered with. So feel free, whether you're here or not, as long as you registered, you will get the resources. And then these are a few tips to make sure you enjoy your stay with us. Please have your camera on if you're in a very comfortable place, and in a comfortable place, I want to be specific because we've had cases in the past where people were not well dressed and then their cameras were on. So please, let's try and make sure that we're decently covered before you can choose to keep your camera off, but would love to have you turn it on. And then the facilitator will unmute you when you need to speak. Please use the raise hand feature in the Zoom when you want to speak, and kindly use the chat function for any questions, comments, and thoughts. So Dr. Bolale Akambi, 2 minutes, give us a brief about Farmalat, what we do and why we do what we do. Thank you. Dr. Bolale, over to you.
Okay, hello everyone. As I've been introduced, I am Dr. Bolale. So I'll be telling you briefly about Farmalat. So Farmalat is an animal health social enterprise founded in 2019 with the primary mission of enabling easy access to affordable animal health care in underserved communities in Africa. So as we all know, animal diseases are one of the leading causes of losses to livestock farmers and pet owners, accounting for over 70% of the total damage. Unfortunately, the animal health system in Africa leaves little to be desired, and it goes a long way to adversely affect these farmers and pet owners who are the lifeline of our local food system. So at Farmalert, we have been able to combine our relevance as a major animal health care brand in the marketplace with our mission of ensuring the easy availability, accessibility, and affordability of these animal health products and services across the country. We partner with local animal health professionals, mainly veterinarians, who partner with these local farmers, pet owners in building an inclusive system for sustainable animal health and disease prevention. So we also foster peer-to-peer network where access to regular animal health products, veterinary services, and pieces of training can be easily obtained, and learnings at various levels of farmers' interaction is being shared. So in summary, we are enabling easy access to quality animal health care across Nigeria and very soon across Africa. So over to you, Dr. Tumsia.
Okay, Dr. Balale, thank you so much for that brief yet explicit introduction of Farmalert. Thank you for that, and thank you for what you do. So I will go ahead and give a brief about Project TECLA. So Project TECLA stands for Tele-Education for Clinicians and Leaders in Africa. And Project TECLA is a Making More Health project, which leverages the ECHO model. So the ECHO model was developed about 2 decades ago by Dr. Aurora at the New Mexico University. So basically what the ECHO model is all about is knowledge sharing, right? Moving knowledge rather than people. And we can all say this is what we're doing today. How is ECHO model doing this? By leveraging technology to share scarce healthcare resources with colleagues. And that's why we're here. Years before now, before the advent of Zoom or even COVID-19, for you to have this kind of discussion or to gain knowledge regarding certain things, you would have to travel thousands of miles or kilometers to either attend a continuous professional development course or to go attend a seminar. But here we are today, we can sit in the comfort of our rooms or our offices and build our capacity. So basically Project TECLA is supporting professionals with capacity building. So we're steering capacity building for professionals, and in this context, veterinarians, right? This same ECHO model is currently leveraged majorly in the human health space, in the education space. And I'm proud to say Farmalert is actually the first to leverage ECHO model in the animal health space. So we're really excited to have you here, and we hope that you're able to gain as much as you can. Please feel free to share your thoughts, your comments, and also your questions. That's why we're here. The ECHO model encourages bi-directional flow of knowledge from the hub experts to the spokes, which, who are the participants. So please feel free to share your thoughts or your questions with us, or if you have any information you feel our community, that's who we are here. If there's any information you feel we need to, you have to share, please feel free to do that. Thank you very much. So we'll go ahead and take our pre-quiz. I'll be launching it from my end here now. So there are just a simple set of questions. We have 5 minutes to engage them. It will appear on your screen. Just attempt them. You're answering it based on anonymity. None of your data is attached to it. We just need the results. And what we do is, it's one of the tools we use to monitor the outcomes of our sessions to be able to serve you better. Thank you. So I will launch the poll right now. Okay. Yes. So let me know if you can see it on your screen. 10 questions, 5 minutes. Thank you. We have 174 people currently in the room. So these are simple questions, true or false. Attempt, you will be able to answer these questions better after the session, because we're going to also be having a post quiz. So let me just keep quiet and allow you answer the questions. Thank you. You can keep your introductions coming. We're 40 seconds gone. I implore us to please engage the questions. Thank you very much. Let's see. Okay, attempts are coming in. Thank you. You can also indicate in the chat box if when you're done, we can acknowledge that. Good morning, everyone. Dr. Shafiu Samaila, Dr. Zedekla Fashe from Abuja. Thank you. Dawn submitted. Okay, Dawn, thank you. Omolola Omikule, Adiola Adetunji, thank you. Dawn Ishaku Joshua Wakawa, Doctor. Okay, thank you. Yeah, this is a good, we have a good engagement rate coming up. Dr. Toyi Olubade, you're welcome. Dr. Abdul Rahman Bello Ibiemi. John, thank you. Dr. Hayelina, thank you. Dr. Anene Nonso. Dr. Mariam Salman, Omolara Ade Naka, thank you. Dr. Abiola, Dr. Olatunji Nasser, thank you. Good morning, sir. Dr. Zainab. Okay, it's coming in very long. Thank you, everyone. Thank you. I'm not sure I can catch up with mentioning names here, but thank you anyways. Okay, Dr. Abubakar Ismail from Guaram, Jigawa State. Dawn, thank you. Dr. Bernard Nwabuezi Sunday, thank you. Good morning, Dr. Uzoma. Okay, so we have 62% engagement. That's good. We're going to have it up for the next 3 minutes. And then we'll bring it down. Thank you, everyone. Dr. Arhel, Michelia, thank you. Dr. Nuhu, Dr. Musa Imam, Dr. David Dan Andeze, Dr. Martins Uchebu, thank you. Dr. Enikemi Samuel, Dr. Elizabeth Somori, thank you. Dr. Adeoti Shahid, thank you. Dr. Ngozi Mary Rose, Dawn, great. Okay. We have a very good engagement rate. We currently have about 71% participation. Well done. And we're just about a minute to go, and I will have to end it. Dr. China Zorita, thank you. Dr. Egu Uche, Dr. Oluwatobi Awe, thank you. Dr. Nana Moro, thank you. I'm sure we have our colleagues joining in from Ghana too. Thank you and welcome. And hopefully from other part of the world, not just Ghana and Nigeria. So we have 30 more seconds to go. We currently have 203 participants in the room. Thank you, everyone. Um, 75%. All right, so in the next 7 seconds, I'll be ending the poll, and thank you everyone for engaging. Yes, thank you. So I just ended. My apologies for those who were not able to attempt, but don't worry, you'll get to attempt the post quiz. So moving forward, I will briefly introduce our hub experts. And after that, then we'll delve into the didactic presentation. And of course, Dr. Femi Kayode will take over and moderate the participatory session. So first we have our Professor Folorunsho Fashina, who will be giving the didactic presentation for 25 minutes. Currently, recently promoted to the position of the Global Coordinator, One Health Epidemic Intelligence and Early Warning, FAO headquarters in Rome. Once again, congratulations, sir. Wishing you the very best. And of course, we have the President of the Veterinary Council of Nigeria, AIG Aishatu Abubakar Baju. Also, congratulations, Ma. She was conferred with the title OON by the President of Nigeria. Congratulations, Ma, and you're welcome. And then we also have Dr. C. Vakuru, who is the Chief Veterinary Officer of Nigeria. He will also be, he'll be sharing his thoughts, his comments, and, the current situation and whatever, we need to know as veterinarians in terms of preparedness for something like anthrax or any other transboundary disease coming into Nigeria. So we should be having a feel of, quality information. And we also have Dr. Patrick Abake, who is the Director of Veterinary Service Directorate, Ghana. So this is, we're going to real life, experience. They're currently battling with the outbreak of anthrax in Ghana. So you're welcome once again, sir, and we're happy to have you here with us today. We hope to learn from what is going on in Ghana now to prevent it from happening in other West African countries and across Africa generally. And we also have Peter Irwin, who is the CEO and co-founder of CowThrive in Ghana, an amazing social entrepreneur. He's also into animal health related activities. So he's based in Ghana. So would also, have quality knowledge sharing today. Thank you so much, everyone. And thank you so much to our hub experts for sparing out time, regardless of your busy schedule, to be here with us today. So we're going to delve into the presentation today. Professor Folorunsho Fashina, I will be sharing my screen I'll be sharing the screen from this end. However, if you're more comfortable with sharing the screen yourself, I can stop sharing and permit you to share the screen from your end. Whichever works better for you, sir.
Yeah, please, you can share the screen.
No problem. So I'll just follow the energy and move the slides. Thank you, sir. Yes, sir.
Yes, thank you very much. And thank you for welcoming and inviting me for this presentation. I will speak from the point of view of Africa in general, using a few examples. Professors tend to be theoretical and academic. I will try to make this presentation practical and not academic. So please, you can move to the next slide. Thank you. So to have a good understanding of what we are dealing with, we need to understand what One Health is. Because anthrax qualifies as a disease that fits exactly into One Health because it has both public health, animal health, environmental health implications. And the basis of One Health is to improve the life of all species, human, animal, environment, through integration of medicine, environmental science, and health initiative. And to do this effectively, we need to be transiting from multidisciplinarity to interdisciplinary to transdisciplinary engagement. What do I mean by this? Multidisciplinary is like in some of the recent cases of anthrax, you see the public health go, come back, animal health go, environment goes, and then they share information among themselves and claim, oh, we've done multidisciplinary engagement. We notify them. No, we need to move to a situation wherein we sit around the table, we plan together, we create solutions together. through a co-creation process, and everybody is involved in achieving the same set goal. And we use the whole of society approach, wherein the society is involved, the stakeholders are involved, and all the different technical experts are also involved. Can move to the next slide. Okay, so basically the HOLEP is one health group of experts that was formed together by the quadripartite. This is actually how they describe One Health. And if you look at it critically, it's a whole of society approach, in which you use the sectoral technical areas, and they all work together through collaboration, communication, capacity building, and coordination, both at the national and subnational level, to be able to influence the society publicly. And ultimately, what we want to see is a healthy ecosystem, healthy animal, and healthy human. Next slide. So in terms of anthrax, we know it's a zoonotic disease, and it's also a disease of poverty, and it's of a public health concern, because when it happened, it actually affects a lot of things, and it also has livelihood impact. It's a bacterial disease caused by Bacillus anthracis, and it's endemic in most parts of Africa. And the outbreak, they are predictable, and they occur in a predictable pattern, almost at a period of the year. And in terms of transmission to animal, is mainly from contaminated soil, water, or pasture. And for human, in most cases, it's through handling of infected meat or infected carcass, opening up of carcass, or opening up of infected meat. And it can occur in three forms. We have the gastrointestinal form, we have the pulmonary form, which are taken mainly through inhalation, and we have the cutaneous form. So here is the problem. We've had report of anthrax in so many parts of Africa. And I will just pick two simple examples that originate from around East Africa and link them with a number of other examples as a basis for our discussion. In 2002, about the middle of last year, we've got a report of anthrax from Kakamega in Kenya. And we have a number of animal deaths, and we also have a number of human cases involved. At least 43 cases or contacts were traced, and 8 suspected human infection were reached. Next slide. So basically, this is the map of Kenya showing Kakamega. Actually, if you look at the situation in Kenya, is that this axis of the country, this western axis of the country, almost on regular basis, do have this infection cycle from about April, May, June into July. And in this particular case, we pick this as a focus of our discussion today. And these are the sub-counties that were infected. Those ones you saw in purple there. Can go to the next slide. So in terms of epic cough, you can see that the outbreak, the report of the outbreak started basically around May and continued until June. There are a number of animal infections, which are the ones you see in blue. And we also have a number of human infections, mainly in the orange color. We can move to the next slide too. So this is also a similar situation which occurred in 2023 in Muranga County, which is also to the western axis of the country. You can see in this case, there was some slaughtering of animals that died, or flaying and division of animals for eating in the home front, which occurred around April, from early April into late April. And then we begin to have human infection. And then this human infection continued until about May, June into the year. Only field investigation was started at the end of April. And disinfection occurred exactly on the 30th of April. And livestock vaccination only occurred 1 month after the infection started, which is about the 30th of, about the 2nd of May. And then we also do some community engagement through risk communication, community engagement, using information, education, and communication material. The interesting thing here is that from the time of the start of outbreak, it takes almost 1 month for any intervention to be done in particular, also including disinfection, including vaccination. From the report we got at about February of this year, vaccination were offered to farmers as a preemptive measure, but most of the farmers turned down the opportunity to vaccinate. The vaccination was just at about 100 shillings, which is just less than 500 naira, if I can put it in naira. I think in cedis now, that may be less than 5 cedis or what. So, but farmers refused it, but then they begin to have infection. Can go to the next slide. So in terms of the signs that we observed in human, almost 100% of the cases show fever. About more than half have lymphadenopathy and upper limb infection, and less than half of the patients have headache, head and neck swelling, trunk swelling, and these other signs. The next slide. And you can see, as we have here, these are some of the signs and symptoms that we observed from the outbreak. You can see this little baby with swollen hand. You can see this Maasai girl on the right-hand side with a patchy swelling on the chin, but you also see a distorted hair. This particular girl had been exposed twice. The previous year, the hair was involved, and that's why you see the hair became distorted. And in the new year, also got a chin infection. You can see the hand infection of these people who were involved in slaughtering of the, or butchering of the carcasses that were infected. The next slide. Also, you can see more signs. The hand were infected, the chin, the neck, and interestingly, we also have the wildlife infected here. The interesting thing is that in this case, the wildlife has served as an indicator, but the community missed it. Because, you know, the pattern of the infection is that at the beginning of the year, when the fresh rain come around April, May, there are fresh grasses, and these fresh grasses, the cow goes out to eat them. They also incur into the national park to eat grasses. Why they are doing this? They are picking infection, which are close to the ground. Because most of the animals that died of anthrax the previous years are buried in shallow grave or left to rot just on the surface. And then when rain comes, these active spores, they become active again. And then the cows are exposed and they pick infection. And then the cycle of infection begins to occur. Some wildlife may have died. Unfortunately, in terms of animal disease reporting, the wildlife rangers are more interested in tourism. They are more interested in poaching and to prevent poaching. So they are not really very keen on animal disease reporting. Otherwise, when they see this, they should have reported to the veterinary authority, which will have prompt early intervention. We can go to the next slide. So in terms of predictable narrative, and these are similar narrative we've collected in so many communities across so many countries, Kenya, Tanzania, Uganda, Ethiopia, you see that the pattern is that a cow typically died in a rural community. And then the owners with a few neighbors may flay the carcass and butchered the carcass. And then the meat is eaten at the household, or the meat is shared in the community. or is sold in the community. In most cases, the identified eaters, they contract the gastrointestinal form of anthrax, and some of them may be presented in hospital. In the last case we dealt with, the first 2 persons to eat these carcasses, they all ended up in hospital and they all died. And then the participants, those who contributed to flaying or to distributing the animal, they also got cutaneous form of anthrax. Some recovered, some disappeared within the system. And the samples were collected in some of these cases and sent to the laboratories. And Bacillus anthracis were confirmed in most cases. Next slide. So in terms of intervention, one thing we understand is that the community have also become very knowledgeable and they are gaining interest in handling situation of anthrax themselves. In this particular case, in some of the community, the medical and the veterinary authorities at the local level, they form a team themselves and they begin to intervene immediately. They were able to produce some communication materials. They were able to set up social media. They use WhatsApp group in the community to disseminate information very rapidly. They were able to do media engagement even at the market level, village market level, and notifying people of the disease. They use the churches, the mosques to disseminate information. They were able to also assist the community in rapid containment of this outbreak in this case. But one thing we notice is that the disease is a disease of poverty, and it's a disease that is associated with food insecurity. Because even though a lot of notification had been given to this community, you cannot imagine a community in which maybe some of the families have not eaten meat in the last 1-2 months, then seeing a whole cow being buried, it becomes a challenge for them. So, and the African community believe that, oh, once I flay this animal and cook it very well, then I'm free. Forgetting the fact that the disease situation is not associated with the cooking, but mainly with the flaying and the opening up of the carcass. So anticipatory action like animal vaccination and right messaging is definitely needed. And this had been exposed to the community. But in most cases, a number of the community members are penny wise, pound foolish. For example, some of the index cases we've had in a number of the situations happen to be people who refused to take these anticipatory action like vaccination, and socioeconomic, livelihood, and anthropological consideration are definitely needed to be able to communicate the right message to the poor farmer. Also, in terms of building national and subnational capacities, it is very, very much needed. For example, you wouldn't think of building capacity at the headquarters, maybe Abuja or headquarters in Ghana, and you leave out the subnational system, which really need this intervention, because intervention at the front line and the time to intervention is what is important in mitigating the impact of diseases like this. The next slide. So in terms of gaps and challenges that we've seen, poor case detection do occur mainly at the subnational level. You've got capacity maybe in the city centers to diagnose anthrax, but not, is it the same at the subnational level? In most cases, the answer is no. So we need to begin to think of moving the opportunity to diagnose a disease of poverty like this closer to the community. Maybe the subnational laboratories, empower them to be able to do this diagnosis, and also for case management in the hospital and clinical setting at the rural community. They are not able to treat this. In most cases, when they see the fever that will say occur in 100% of the cases, they think of malaria. So they begin to treat malaria. And the situation when it's not resolving, that's when they begin to think of utilizing antimicrobial. And it is much later along the line that most of them think of doing testing and confirming maybe Bacillus anthracis. So case reporting is also poor. And this case reporting is associated with trust. The trust gap is there between the medical, veterinary, and the community. So we have to begin to think of the whole of society approach, wherein we bring in the society to come in, sit with them, co-create solution, co-develop ways and framework by which reporting can be made better. Also, poor health-seeking behavior is there in the community. In fact, in most of the households that we visited, when they have these children with skin infection or chin infection, they consider it, oh, it will go by itself, or they just treat with, they buy some capsule of tetracycline and just pour the tetracycline on the wound and believe the thing will dry off by itself. In some cases, this resolve, but in some cases, the case progress and become worse. Livestock vaccination also, it's poorly adhered to. Most of the farmers sacrificing the 100 shillings to prevent the infection of the animal or the death of the animal become difficult for them. And so we need the social scientists to begin to help us communicate this type of message to them, to practice what is right, to practice anticipatory action. Also in terms of harmful cultural practices and their beliefs. For example, in some community that we go to, the community said that, so in our community, it's forbidden to bury animal because the gods of the land will be angry if we bury animal in the same land where we bury human being. So when animal died, it's either they flay and distribute or they leave it to rot on the surface. And this become a challenge in the future years for anthrax. The next slide. So in terms of way forward, as I've mentioned, we need to begin to think of capacity building of health workers at subnational level. And I'm happy both the CVO for Ghana and Nigeria are here. I want to encourage you to think of helping to build subnational capacity and not only around the city centers. Most of the cases of anthrax are not observed at city center. You see them in the rural area or in the peri-urban area or in the underserved community. We need to begin to think of continuous empowerment through focused livelihood support. Livelihood support doesn't mean you need to give them money directly. Teaching them about good farming practices like Farm Alert and a number of other institutions are doing. The cow tribe, both in Nigeria and Ghana, we need to strengthen this. Teaching them about biosecurity, communicating the right public health education to them. For example, this type of fora, I expected us to also begin to invite our public health colleagues to participate in this type of engagement and bringing them in as part of the co-designer of solutions. Development and use of relevant IEC material. I will show you a few of them that we prepared and used in the case of East Africa. Targeted livestock vaccination and strengthening extension services. I know that most of the extension services that service agriculture currently are more focused on plant. We need to begin to strengthen animal health extension services too, and use the whole of community approach in terms of disease reporting. For example, sentinel indicator system. For example, we talk about the wildlife, wherein the wildlife ranger may be involved. And when they see death in the wildlife, let them just report it. And then let the veterinary system take over in terms of following up. The next slide. Yeah, these are just some of the material we developed. Right on the left-hand side, you see the leaflets, the leaflets that we developed for the community. It's a 2-pager leaflet, which the community are using. In the center there is the brochure, which we develop also in local languages and which can communicate the disease situation to them, as well as provide number they can just dial, free toll, and through which they can report disease. Also on the right-hand side there is posters that we prepared and we posted in churches, in mosques, in market area, in schools, and in communities. And these were used in terms of mitigating the disease situation that we have in this case. Over. The next slide. I think that was the last slide. Thank you.
All right. Thank you very much, sir. And so this I will hand over to Dr. Kayode Femi now, and he will start the participatory session. I'm sure before that we'll have our the remaining hub experts say one or two things before we start taking our questions, thoughts, and comments. Dr. Kayode Femi, over to you. Have a nice time.
All right. Thank you so much, Dr. Tumsia.
Let's be time conscious, though.
Thank you. So can you just bring down your slide?
Yes, I'm
so
just
that we
doing
can
that
have the
now.
full room.
I'm doing that now. Yeah.
All right. So I think it's time to now dig out and discuss around the issue at hand. And I want to thank every one of us for joining. I have the privilege to be leading this session. I want you to please kindly spotlight all our hub experts. If you can spotlight AIG Aisha too, spotlight
the tech team.
Mr. Peter Awin. Now, I shared my private link with 2 or 3 people. Among them are also the hub experts. So Dr. Anzaku is representing the Chief Veterinary Officer of Nigeria. If you can quickly just rename yourself so that we know which of the Kayode Femi that you are, and then you can, of course, be quickly spotlighted. Then we have, so the Veterinary Services Director, Dr. Patrick, the IT team said they cannot spotlight you, they cannot find you. So if you
can he just say hello or raise his hand or something?
If you can just raise up your hand or say hello so that we can find you and then bring you to the spotlight, that would be a good thing. IT support, I think you can spotlight every of the hub experts at this point so that we can all have them on the screen. Then we can have a very nice conversation. So we are talking about anthrax, and then the Professor Fashina has just closed one of the discussion around people saying if they bury cow where human beings are being buried, that's a taboo. So that also go a long way to tell us that in Africa, we still believe things that should have been debunked by science, right? And also still tells us what level we are in Africa and why anthrax has persisted up till date. And we are still having multiple outbreaks around that. You know, I was in a meeting, and I asked a few set of young students, did we evolve or God created us? And the collective answer was that God created us. Yes, I agree. But we need to start mixing science with our beliefs and allow a few things that we do as professionals also be subjected to things that work and things that doesn't, so that we can at least educate people who are coming behind us. So let's start with AIG Aisha Abubakar Baju. If you can spotlight her, I really will love that we all are spotlighted.
Tech team, please spotlight AIG, spotlight Professor
and also
Fashina.
Maybe Peter Awin also, if it's on, can you please spotlight him? So let's Mr. Peter Awin. So tell us, you've been at the forefront of animal health in Ghana. What's happening? Are people dying?
Yeah, thank you very much. I thought our chief director was going to be, veterinary officer was going to be on the call. So can probably speak to the technical aspect of what is happening in Ghana. Yeah, we've been hit by this outbreak. It's been almost 3 weeks now since we started managing this situation. And I can say that on the ground, we've come together, brought together all the forces we can to ensure that we are responsive to the outbreak. So as we are speaking, all the outbreak management protocols are ongoing. I can even say yesterday there were a lot of vaccinations going on the ground. We have pictures of veterinarians in the field, ensuring that all, communities and animals are getting access to vaccines as a way of preventing the situation. So I can say at the moment, things are calm as compared to about a week ago.
All right, thank you, Peter. I'm still coming back to you, but let's ask Dr. Vakuru, Dr. Anzaku, who is representing the Chief Veterinary Officer of Nigeria. So is there an anthrax outbreak in Nigeria? We need to be sure of that first. Or else we are just accusing Ghana for something we also have. I'm trying to rename you, Dr. Anzaku. I think I found you. So he's being renamed. Can we allow him, make him a co-host so that he can unmute himself?
So I just asked him to unmute now.
Okay, fantastic. Fantastic.
Yes. So can you spotlight Dr. Anzaku too? IT.
Yep.
All right, great. Good.
So, Doc, good to have you around. You're also a director, a very senior director at the Federal Ministry of Agriculture and Rural Development, representing the Chief Veterinary Officer. I want to ask, do we have an outbreak in Nigeria?
Not for now.
Right. So, but the ministry came up with a note advising veterinarians to be at the forefront of or to be alert around the disease since our neighbors are having that. What do you think? Why do we still have this reoccurrence of anthrax outbreaks in Africa? What's your perspective on that?
I want to say that, yeah, just like you said, I'm actually representing the Chief Veterinary Officer of Nigeria, Dr. Vakuru. Anthrax, I want to say, is actually a neglected zoonosis. Not much attention is being paid to anthrax, yeah, because most of the outbreaks, I want to say, are actually sporadic. They're not like the conventional zoonosis. So people don't think much about anthrax until you have case fatalities. So the case in Ghana is actually a wake-up call to all of us. And that is why the ministry sent the advisory. But let me also just let you know, as part of our strategies, we have also established the National Technical Working Group on Anthrax, all in a bid to prevent and prepare for anthrax and the possible effects on the public and our livelihood.
And that's a brilliant one. So you just got to put in place the National Advisory Committee.
Yes, National Technical Working Group.
So what's the job function of that committee? If you want to share a brief light on that.
The National Technical Working Group on Anthrax is an expanded, multidisciplinary, multi-sectoral committee that was under the guidance of the Chief Veterinary Officer of Nigeria, was established on 13th November. And their job schedule is actually to design programs and measures that will help in preparing for and preventing the introduction of anthrax into Nigeria. And if already introduced, or if there are outbreaks, we can be able to mitigate it. And we had a very useful discussion at that meeting. We have people from the Federal Ministry of Health, NCDC, NSA, that is National Security Advisor, development partners, civil society organizations. We were all part of this committee, and they came in persons, not even virtually, considering the importance of this. And they are already working on, for instance, the risk communication messages that will have to be dished out to the public using the multi-sectoral and multidisciplinary approach.
All right, thank you so much for that, Dr. Anzaku. I'm still coming back to you shortly. But to Professor Fashion, anthrax can be prevented, right? The outbreaks can be prevented. Am I correct?
Yes, definitely. Anthrax can be prevented very much. And I'm happy to hear that the ministries, both in Nigeria and Ghana, are doing something. And it's also gladdening to hear that you are involving, using the whole of society approach. Like the situation that happened in East Africa, first in Uganda around April, then Kenya, then Ethiopia. For example, through our collaborative engagement, we were able to assist them in mobilizing a sum of $500,000, which was shared between the three countries in terms of mitigating this disease. Typically, we know that the national system will lead the protocol in terms of disease mitigation. But don't forget that you've got partners in the CDC, in the ECTAD, in the FAO, in the different organizations, WHO, and so many other partners you have. At times, if you don't involve this partner, they sit and wait for you to do the science and they will read the report. But they are supposed to be your collaborative partner when you have issues, when you have challenge. I've challenged a number of the officers at the ministry. Please go to ECTAD. They are your partner. Much more. Most of the people there are also Nigerians. They are part of us. Most of the people there in ECTAD Ghana are Ghanaians. They are part of you. So you need to work very closely with them and make sure that this engagement continues. But anthrax can very much be prevented. Thank you.
All right, thank you. Maybe I should quickly get to Peter and then come back to the president of the council. So anthrax can be prevented. Peter, you are at the forefront of distributing vaccines in Ghana. What happened? Why are we having challenges around spreading that vaccines?
Yes. So yes, thank you very much for that question. Just to give you a brief about what CalTribe does. So CalTribe started in 2017, and one of the key questions we asked was, why do we have diseases like anthrax, so many other diseases, killing livestock and humans in Africa, and what can we leverage on technology to be able to reduce those incidents of diseases? And so since 2017, we've actually been building technology platforms to support the fight against and control of diseases across Africa. We started in Ghana and we focused on certain diseases. I think I can just mention them: Newcastle in poultry, PPR in goats and sheep, and then CBPP in cattle. So for the past 5 years, we've mostly been running pilots and learning sites, in learning sites across the country to see how technology can actually be able to help in optimizing delivery of vaccines. I just want to go into, all of these outbreaks are actually a reminder that we need to do more. And that is why technology has become something that we think can help us to do them more. So it's not just anthrax. There have been several outbreaks of like Dr. Prof. Sorry, the name. Yes, mentioned. These are endemic outbreaks. Like they are endemic diseases. They come up at seasonal, during certain times in the year. So even though our effort, so far we've distributed almost 20 million doses of various vaccines since 2021. But that is not enough. I mean, this anthrax outbreak alone, we needed to distribute about 1.5 million doses. And it is hard to say that the stockpile was not even up to 20,000. So as soon as we heard that, as a company, we stepped in to see how we can increase the stockpile. So as we speak, we're able to get about 100,000 doses out there within 1 week of providing support to the government. And now they are in the field distributing the 100,000, but that is inadequate. So as much as we are providing technology to make sure the vaccines are getting to the right farmers and getting data on who is receiving what, there is still a gap in how do we provide, adequate resources for development, for production of vaccines. Because I don't think it's only about Ghana. It's everywhere across Africa that, farmers are supposed to pay for their vaccines. So if farmers are not demanding, because it's a demand model, if farmers are not demanding, then we don't even have the vaccines available for some of these instances. Because, when they happen, we should have enough vaccines in place to be able to distribute. So I think that is the key part of the challenges in getting, vaccines as part of the control measure. But again, I think if vaccines continue to be a demand-driven commodity, then we would continue to have these issues, because there are certain diseases that I believe that through collaborations and partnership, we should be able to have an affordable way of making sure that every farmer is receiving vaccines. Because if we leave it to the farmer to decide whether to vaccinate or not, at the end of the day, these diseases will continue to exist.
Thank you so much, Peter. You run a demand model, and you mentioned critically that we don't have enough demands for these vaccines. The key question will now be why. And I want to go to the president of the Veterinary Council. But I also saw on the chat that the MVRI director, because she's also at the forefront of producing these vaccines. Are there anthrax vaccines? What are the demands compared to the demands we have for CVPP? Is there anything, and I'll come back to Dr. Anzaku to ask, is there anything the government is doing to ensure that veterinarians, over 5,000 veterinarians on the field, educate farmers on the need to vaccinate? But let's go to the president of the Veterinary Council. AIG Aishatu Abubakar Baju, welcome, Mark. You superintend over the training and the education of more than 10,000 veterinarians across the country. And it's our belief that veterinarians should be championing this cause. I think anything that causes an outbreak is as a result of a broken system or a disorganized system where veterinarians are not championing this cause. You've been saddled for the second time with the responsibility of being in charge of the training and the practice of veterinarians across Nigeria. What is it that the council is doing to ensure that we stop this needless reoccurring of some of these diseases that we can actually eradicate if we are together? Thank you, Madam President.
Yes, thank you very much, Farm Alert, for organizing this very, very important webinar or a Zoom conference in collaboration with our colleagues from Ghana and other places, and also the FAO. It is very timely, and so, well, Council, as you are aware, is not practicing per se. It's like it is the regulatory body of the profession. Our own is to regulate practice, as you said, and the training, the knowledge of veterinary medicine in Nigeria. Well, on our own part, where you're also part of the council as a board member, we are working like this morning is a very topical issue where we're talking about our curriculum. When we came on board, you will recall that one of the roadmaps, we know we had a roadmap, and one of the major area here on our roadmap is looking at our veterinary curriculum in general to ensure that we have the one competencies in line with the OIE regulation, just to make sure that veterinarians get the best training they can. And even this morning, the issue that is being discussed on the council platform is about the review of veterinary curriculum. Another aspect is also the issue of regional collaboration, which is very, very important. It's one of our the items on our roadmap. I'm happy today that we are having an interaction and interface with our brothers from Ghana, sharing from their experiences. And from what he has talked, the first thing he said is about sitting together and planning together. I think it's apt, and we really need to do that, to sit together as ECOWAS first from the region, because regional collaboration is very important, right from our veterinary curriculum to ensure that the curriculum flows together so that I can walk into Ghana as a vet and there won't be any need for any certification. We know that we have a benchmark, we have the same kind of curriculum. Similarly, the whole of society approach, very welcome, because you have to carry everybody on board. On the part of the council, as I said, being a regulatory agency is to ensure that we have the highest standard of practice. But just like the representative of the CVON has said, most of these policies lies in the office of the Chief Veterinary Officer of Nigeria, which of course they are doing all it takes to make sure that veterinarians are put all their hands on board to ensure that we are the level of preparedness, because they say if there's an adage in Hausa that when the mustache of your neighbor catches fire, you should be able to also prepare yourself, put water on yours so that the fire will not catch yours. So I believe that the office of the CVON in the Federal Ministry of Agriculture, Rural Development is doing great, first by being proactive and coming up with the National Technical Working Committee so that we are prepared just in case, because of course our boundaries are open, cattle move from all our neighboring countries, they move around, so we have to be prepared. And the council is working seriously in collaboration, hand in hand with the office of the CVON to ensure that the right thing is done. And I think we are on course, especially with this interface this morning, so that we can share from our experience, the experiences of our colleagues from Ghana. Thank you very much.
Fantastic, Madam President. Also, thank you for the effective collaboration with also the ministry, because quite a handful of things is also at the decks of the CVON, and the coordination with veterinarians across the country will be like an interesting collaboration that can help us solve this. I'm also happy that the executive director MVRI is on the call, but I will call her after asking this question, after asking Dr. Anzako this question. Dr. John Bassi said, part of the preparedness for an outbreak should involve mass vaccination campaign across the country. He said Redice has been working on mass rabies vaccination across the country, and he believes that anthrax vaccination should also be at the focal point. Is there anything on the decks of the Chief Veterinary Officer of Nigeria to prepare us? The movement of cattle, I know we have borders, but our borders are porous. The movement of cattle, I'm not sure if it's well understood in the country. If we have an outbreak in Ghana, there will soon be, in fact, while we're spreading the news for this meeting, somebody in Kaduna State, and I don't know if the Director of Veterinary Services for Kaduna State is on this call. Somebody said there's an outbreak of anthrax in Kaduna. Of course, we cannot say that until we get a letter from the Chief Veterinary Officer of Nigeria. Is there any intentional mass vaccination campaign that the ministry can drive? After your answers, then I will call the MVRI director to talk about the anthrax vaccines and if it's available, where and how. Thank you, Dr. Anzako.
Thank you very much, Femi. Just like I told you, the ministry, since we received this information. Sorry, are you hearing me?
Yes, loud and clear, we can hear you.
Yes. A lot of things are going on simultaneously. And just like I'm happy that the ED MVRA is also here. We've been speaking with her, and we have both immediate action and long-term actions that want to address the issue of anthrax. The immediate action is to do an immediate vaccination of animals along the frontline states. We have identified the states from northeast to west to the south-south, all the states that are the boundaries. And the idea is to be able to, part of the vaccinations we're going to do is we're targeting at least not less than 1 million animals immediately.
Wow.
And we want to use this vaccination program to do what? To even sensitize people. Because as the vaccination is going on, people are going to really understand, and they'll be made to understand the effect and the possible harm that anthrax can do. And like I said, somebody mentioned about Redice. We have also spoken with the Health Press project, that we want to do a more massive, where we'll target over 10 million animals. But like I said, those are plans that we want to do. And I want to, at this point, actually even on behalf of the CVN, even thank the EDNVRI. She has also been very proactive, based on our discussion with her. And within a very short time, she has produced about 1 million doses of vaccines, of anthrax vaccines, that can be deployed for the immediate implementation of vaccination along this borderline. Like I said, the plans have not been finalized, but these are things were in the last stage. And I think within the very shortest possible time, these activities will be done in the frontline states. And I want to assure you that the permanent secretary, since he got this information, has never left us to rest. He's been very, very much supportive, giving us directives, and he's been asking for updates. So you can see that as a ministry and as a department, we're doing very well to make sure that we coordinate these activities to the glory of God and then for the betterment of humanity. So be rest assured, a lot of things are going on. And as I'm talking to you, the National Technical Working Group are working, developing a work plan, on a comprehensive work plan for the eradication and possible control of anthrax in Nigeria.
All right.
Thank you.
So this is heartwarming, Dr. Anzako. This is really, really very heartwarming. And then, of course,
sorry, Femi, let me just also let you know, we're also having a Zoom meeting this afternoon.
Yeah, I saw that.
It's almost in line. Yes, I'm sure you must. So just to let people know, in addition, and we didn't want to tell you we are doing this, it's all part of the collaboration. Fantastic. If you can support and do this, and we're also doing this, it's all for the betterment of the livestock industry and for public health. And that is why we agreed to participate at this program, because we're not doing anything different from what you're doing, but we're collaborating and supporting. And that is why, like Professor Fashion mentioned, just to assure him that everything that we do, FAO ECTAT is there, CDC is there, NCDC is there, the Breakthrough Action, WHO, Core Group, so many other partners are there. And we do this collectively, collaboratively. So even with this one that we're talking about, they're all part of the National Technical Working Group on Anthrax. And they are also part of this Zoom meeting that we're going to have. They are also inviting other people who don't even have access to this meeting. So it's a very strong global collaboration. It is not just, it's just being anchored and coordinated by the department. But like I told you, it's a One Health issue, and it's being done collaboratively with all these concerned groups. So as we have invited everybody, we expect that you also help us in also inviting people again.
No problem.
Thank you very much.
That works. Thank you so much, Dr. Anzako. Especially, you know, why you were saying that 1 million cattle will be vaccinated, that I saw a handful of people clap, because when we are proactive, that's when we can solve majorly the issues that revolves around animal health in Nigeria. I think Dr. Mark Ofwa is the chairman of MVME in Lagos State. He said, I was in Ghana last week and I find the level of awareness in country of the outbreak to be very low. Locals are not aware of the outbreak, and even at the bush market, a very likely source is not sensitized and bush meat is handled freely. Nigerian even seems more alert than a nation where an outbreak is currently. So Peter, I'm going to be asking you that, but I've still not been able to get through to I don't know, if you are the director, Veterinary Service Directorate in Ghana, Dr. Patrick, you probably haven't joined with your name. You could just drop a message on the chat that you are Dr. Patrick, then the IT team behind can bring you up. But I want to take Dr. Miriam. Dr. Miriam, you will be, okay, fantastic. You're spotlighted now. So again, you are like the heart. The Veterinary Council could be like the hand and the leg that walks around. But if there are no vaccines available, of course, we could do nothing. We would just move with mere normal saline and keep talking. What is it that you're doing? I know you must have been bombarded by a lot of calls during these last days in preparation for maybe a possible outbreak in Nigeria. I want you to share your perspective and what it is that we need to know. And lastly, to ask the questions, are there vaccines on ground? Are we prepared?
Okay, thank you. Good morning, Femi. Good morning, everyone.
Good morning, ma'am.
Yes, NVRI is part of the technical working group. We have attended the meetings where the plan is being worked out. And prior to this, we had an order of the vaccine from Bamako that they already had. They had an outbreak, I think, in March. So once we got that order placed for anthrax spore vaccine, we also began to prepare a stockpile because we knew that perhaps other countries in the region will need the vaccine. So like Dr. Anzako has said, we currently have a stockpile of 1 million doses. We are ready to move and double that within the next 10 days. The issue is to get the partners who will support with the payment of these vaccines to enable us continue to produce. But currently we have 1 million doses, quality controlled, labeled in the cold room, ready to move as soon as the work plan is concretized and on the ground. And as I said, we will continue to produce once this has been activated. Thank you very much.
All right, so let's do a little marketing.
Okay.
MVRI said there's 1 million doses of vaccines available for anthrax.
Yes.
And I know majority of the veterinarians who have joined this meeting are probably interested in the large animal practice or are actually at the forefront of large animal practice. Dr. Mark, the comment I just read earlier said there's low awareness. Once you tell them that there's an impending danger, and fortunately for us, the farmers believe us veterinarians, we should let them know. We should order the vaccines and then ensure that at least we protect our livestock while we still can before a possible outbreak. But I want to commend you, Dr. Miriam, since you become the director, executive director, there's this very renewed hope. We believe what you're doing. I want to thank you for the support that you have given so far. And then we could talk about other details after the meeting, but please still stay on the meeting just in case there are other questions. I want to ask Peter, go back to Peter now. So why is awareness low in Ghana? You have the issue. We are more concerned in Nigeria because you are our neighbors. We know we should be our brother's keeper, but the brothers should also keep themselves, right? What do you think? Why is awareness very low? I would have loved to ask the director of veterinary, Veterinary Services Directorate in Ghana. But again, since you are here as also an hub expert, Peter, why is the awareness low in Ghana?
Yeah, thank you very much. So I do think, you know, generally education and awareness needs to happen, and not just during an outbreak situation, but at least there has to be systems in place to ensure that at any given time, you can be able to reach the relevant people or the population with news and education on certain topics. You know, when we're talking about disease like anthrax or any other, you know, zoonotic diseases like rabies and other things, we're talking about those affected are also in rural areas. They are in very hard to reach places. And so the conventional method of educating people through maybe television or newspaper and other things, which is what most people hear about, would not necessarily reach them. And that is why, you know, you and I have been, you know, talking a lot about how do we even get farmers alert about some of these things and how can we leverage on technology. So in CowTribe, what we have done in the past 5 years is to build a voice-enabled awareness program where everybody with a phone, with just a click of a button, can actually receive information about whatever is happening within the country. And as far as diseases are concerned, we can be able to do that. And we do that in all local languages, support all local languages. And currently, as we speak, we are able to do that within the places where the outbreak is happening. But in this, for this to really work well, you need to have, the numbers of every farmer or anybody that is needs to hear, so that you can blast these messages. And so data is becoming really, really critical. And the type of data we need is not the data we needed like two decades ago. We need to start thinking about, the very direct way of communicating with people. And that's what we are building. I've heard about what you are doing in Nigeria, and I'm really, really impressed with how proactive you have been. Maybe that's what we have to learn in Ghana. We need to be able to start thinking about how can we already have data in place so that when there are outbreaks, we don't need to be struggling to communicate or even to reach out to farmers. And like I keep saying, that is what Car Tribe is building. We are building the first ever, vaccinations and outbreak management software, which is currently being used by the government of Ghana to run this particular outbreak management, because then you can have the farmers on the platform, you can have all the livestock loaded on the platform, and as soon as there's an outbreak like this, you can actually trigger a vaccination program so that every farmer is targeted, every livestock is targeted. That is really, really critical in the way that we create awareness too, so that everybody is involved. You know who is receiving vaccine, who is not receiving, and then you can actually, target those ones that are not, willing to vaccinate. And that way you are able to also efficiently use resources. So we are excited to even begin to think about, I hear questions about how can we collaborate. This particular tool is freely available. It's a freemium tool that any country that wants to use it, just like what Ghana is doing, can use it. So that before any of these outbreak will happen, we already have data of our farmers and our livestock. And as soon as we want to do vaccinations or awareness, we can trigger those ones from one central location.
All right, so Peter, I want to thank you for that. I know you've mentioned that to us in Farmalat, and we could take this discussion offline to see how we can collaborate on that. I'm still coming back to you, but I want to get to the president of the Veterinary Council. But before then, I want to read somebody's comment. Dr. Abdurrahman Bandre, he's from Somalia. I'm happy you're here. I'm going to give you a few moments to talk. You said the last 3 months, how can you have the anthrax vaccines? I will allow you to share 2-3 minutes to share your experience in Somalia. Maybe there's something we can learn. But I want to get to the president of the Veterinary Council quickly. Somebody raised a comment around the risks in our abattoir. Well, one of the key reasons why we're concerned about this anthrax outbreak is largely because of the zoonotic potential. Well, we understand the economic impact on our cattle industry, on our livestock industry, but we are also concerned that the people at most, at the risk of contacting these anthrax are the people in our abattoirs, slaughter slabs. And I think it was Festus Swem, Dr. Festus. He said the situation we have in Nigeria, especially in the abattoir, makes the country very vulnerable to an outbreak of anthrax. And then, of course, the vets or the animal health technology working at the abattoir are so much at risk. Madam President, what will you say to vets listening? We have over 250 vets joining this meeting. How should they take this in terms of sensitizing people at the abattoir? Like, we need to really be intentional. I know the Chief Veterinary Officer of Nigeria also have a very big role to play, but you are directly in touch with veterinarians nationwide. What will you want to tell veterinarians around the impact of this anthrax in our abattoir, Madam President? Is the president still on? All right,
service. The veterinary manpower gap where they see vets are bridging in the states where they have been posted have been seen to be reporting diseases that some states have not reported in more than a decade. And not because these diseases don't exist, right? But because, of course, there is no system in place to report and surveil these diseases. So this is one of, this is an opportunity, and I think we should actually look into it. Who is Shamsuddin Fabo? It's been an exciting meeting. Kudos to Farmerlab for organizing it. Thank you so much, Doc. Dr. Kayode will be back on shortly. Okay, I think I'll throw this question. Let me just keep it going before he comes back. Professor Fashina, somebody is asking here, Dr. Nampam Ibrahim, how often are animals, how often do you need to vaccinate animals against anthrax? I think Dr. Professional should answer this question for us, Prof.
Yes, thank you. With regards to the vaccination for anthrax, there are different types of vaccines that are available. There are those that you need to do just once a year that I know of in East Africa. There are those that you need to do maybe about every 6 months. And most of those vaccines for anthrax are actually combined. Like we have Blantrax, which contain blackwater, anthrax, and another vaccine combined together. So the protocol may depend on the vaccine that is available. I'm sure the team at MVRI will be able to give guidance on the vaccination protocol that is available in Nigeria, possibly in Ghana. Thank you.
Okay, that's really interesting. So if we have researchers from MVRI, can you kindly provide us with the kind of vaccine we have available here in Nigeria, and when and how often should these animals be vaccinated, so that we can have that information? I know we have a schedule that we're all taught back then in school. However, what is obtainable in the field is what we need to know as veterinarians. There is also need to seriously discuss veterinary manpower. I agree. And I think as individuals, we can also, can anyone hear me? Because Dr. Emeka Asiegbu is complaining. I guess it's your network from your end. I hope people can hear me because my network is actually in good shape. So let's hope maybe it's the network from your own end. So there is also need for us to, actively sensitize our community. I think as veterinarians generally, we should not always wait for like an organized forum before we can say we're sensitizing. We like the female veterinarians in the room, we go to buy meat maybe every other day or every week, depending on how you plan out your groceries. I had a chat with my meat seller 4 days ago, and his table, there were like 4 people selling meat because that's where I go to get. So this is something that I feel we can also, it will go a long way rather than just keeping quiet, right? But so anywhere you find yourself, make it a habit of sensitizing people, not just when we have like an organized forum where we have flyers and we gather people under the same, because there's something called spiraling. You don't know who, you're telling somebody now, he's telling another person. Before you know it, more butchers are aware of this disease. So I would just check in with Dr. Femi to see what he has to say. Oh, okay. So yeah, thank you so much, Dr. Musa Imam, for bringing my attention. So let me allow Director MVRI to provide us with that detailed information on the kind of vaccine we have available and the recommended schedule. Ma'am, if you're still on the call, can you please come up to let us know what vaccines we have and the schedule we're supposed to follow on the field and how to administer it. Yes, Dr. Zainab Dambazal, thank you so much. I can see the good work, your flyers, your info, is it infographics, they call it on LinkedIn. You're really doing an amazing job with this sensitization and enlightenment of zoonotic diseases. Dr. Mariam is here. Ma'am, are you still here with us?
Yes, I am. Can you
Yes.
hear me?
Yes, ma'am, loud and clear.
Okay.
Please, can we spotlight Dr. Mariam? Thank you.
Okay. I think I will just go ahead before the spotlight. With regards to the anthrax spore vaccine, we have only one type of vaccine, and that's the killed vaccine. And we have a brochure, we have a flyer that we normally give when people come to procure vaccines, to say that our advice is to have the anthrax vaccination annually, particularly around cattle that grown, that are kept on soil that is prone to the spores. As we know, the anthrax spore can remain in soil for a very long time, and our biosecurity measures are not up to par. So what we advise is, particularly for those who are fattening cattle and keep them in confinement on soil, and even those that graze, that the anthrax spore vaccine be administered annually on cattle from 1 year old.
Okay. Somebody is asking, I'm not sure we should, but it's fine. I'm sure doctor can provide us with that information, or if there is one of the MVRI officers who can help us, because Dr. Zakaria Audu here is asking duration of immunity, the dose, and then also the route of administration. So are we expected to vaccinate these animals annually? And for how long does the immunity last? And the route of administration. So it's a killed vaccine. So we expect that, I don't want to, it's where I am. And then we talk about the dose and also the duration of immunity. So I'll allow our colleagues from MVRI to provide us with that answer.
So it's a liquid vaccine, so it doesn't have to be reconstituted. And we sell it, I think it's 100 mils. Let me check with the producers. I think it's 100 mil per bottle, and it's 1 mil administered IM. And as I said, for cattle, the advice is that you vaccinate annually.
Annually. Okay, thank you so much for that information. Dr. Kayode Femi is back on.
Thank you. Thank you, Dr. Tumsia. Thank you.
All right, then.
All right, so for people who want to buy anthrax vaccine, let me be in the middle and also say that Farmalad is at the forefront of distributing vaccines. If you find it hard to reach the big woman, you can reach us. And then we can reach the big woman and then reach you back. So we distribute CVPP anthrax vaccine also. Fortunately, so the Ghana director has been on the call, but with a different name. So I was out, I got that resolved. Kingsley, please, IT, can you bring up Kingsley? I said that on the chat. We will need to hear from them. Fantastic. I've seen you since at the inception of the call, but we really didn't know that you were the director. So let us know what's happening in Ghana. And we have virtually all our expertise on the call. We have the MVRI director, we have the Chief Veterinary Officer of Nigeria, we have the Veterinary Council President also, and then a host of others that I will be acknowledging very soon. So what's the story in Ghana? And how can we be our brother's keeper? First of all, what's the story? What are you doing? And then how can we be our brother's keeper?
Okay, thank you very much. I have to tell you that what I have to say is that the anthrax outbreak actually happened in the Upper East region of Ghana, in the community called Binduri. And then thereafter, it was confirmed on the 31st of May this year. After the confirmation, we moved straight into measures rapid measures for response. And some of the measures we did were, first, we had to organize community debates in the districts all surrounding the area where the anthrax outbreak occurred. Let me tell you something. Hitherto in Ghana, some time past, some 20, 30 years back, anytime we had an outbreak, we only cordoned only 8 kilometers radius for vaccinations. We have now moved away from that. When we had the outbreak, we decided that the whole of the Upper East region was in danger. So we did vaccinations all over, and we are still doing vaccinations. I want to answer a question about awareness creation that somebody asked, and I'm very much interested in that. Yeah, it might seem that our awareness creation has not gone very far, but then there are things that we did after the outbreak. And one of them was the community debate that we held in 6 districts of the Upper East region and more. The next thing we did, because of the incoming Salah festivities, we immediately had to go and see the chief imam of Ghana and discuss the issue with him. What was the idea? The idea was simply for the chief imam to echo whatever it is, and then make sure that all the mosques in the country will echo the idea that we have a problem with anthrax at hand. Because you know this Eid al-Fitr and whatever it is, they usually use animals for celebrations. So we took all the
Right. So I want to be sure that Dr. Tumsia, can you confirm you can hear me?
Yes, I can hear you. I think it's his network.
Okay, his network.
Yeah, maybe just give him a few seconds and probably just continue the discussion before he comes back on. Yeah, I think he went off. So I think
so he went off. So let's I want us to, within the next few 10 minutes that we have left for this interaction, now see how we can. I'm going to give a couple of people just one minute to talk. But before then, let me acknowledge the presence of Dr. Charles Ibe, one-time national president for the Nigerian Veterinary Medical Association. I also want to acknowledge the presence of Professor J.D. Amin. Thank you so much for joining. The Commonwealth president also is also on ground, a member of the Veterinary Council, Dr. Tunji, Dr. Latunji Nasser. I also saw a director of FMAD, also retired, Dr. Doshima Kwangi. Thank you for joining. Dr. Adamu Elioji, also an epidemiology officer, retired from the ministry. Thank you all for joining and then contributing to how rich these conversations has been. So I want to get back to Professor Fashinam. I want us to, at this point, start laying the foundation. We've operated as individual countries. There are moves to make us operate together. Maybe let's even start with West Africa. How do we now start working together? If you're going to give 2-3 steps that we need to take to start working together to strengthen the animal health sector in Africa, what will those few steps be? Professor Fashion.
Sorry, I have to be moving now because I'm attending to another meeting as I'm on my way. So fantastic. With regards to working together, one of the ways by which we can do that is one, using our veterinary associations. For example, like when the MVMA is organizing its conference now, you can invite a few individuals from the Ghana Vet Association. Come and participate in our meeting. We want to hear your experience, one. Secondly, we can begin to look at disease with a epizoonal approach. One thing we need to know is that disease does not respect boundary. A disease that is occurring in Ghana is just a matter of somebody taking it across the boundary. It becomes a challenge in Nigeria or Benin or Togo. We need to begin to look at disease with epizoonal viewpoint, and then everybody needs to begin to co-contribute. And then we need to strengthen training and capacity building at our border. This will assist us. For example, most of the time, based on my experience, the people we've had at the border, at times I've seen ordinary administrators doing the work of the veterinarians at the border. For example, in terms of certification of animal in crossing into the country, I'm not talking of Nigeria or Ghana border now, but I've seen this in some borders where we even interview these people. Have you had any training in animal health? No. Have you had any knowledge about how animal health work or animal health system work? No. But yet, this person is only interested in certifying the animal, getting the amount of money that is necessary for the government. So revenue become more important to them than animal health. So these are some of the issues we need to begin to look at. And so even in terms of our training and planning as animal health or public health official, we need to begin to bring in some of these social scientists and let them know the impact and import of what they are doing and what they are not doing right, even at such border level. Thank you.
Thank you so much. I think once that is done, when you were talking, I remember the Redise, I don't know whether the ESAVET program is under Redise. I also recollected that they just trained a few set of veterinarians and there was this graduation that happened, was it yesterday or day before yesterday? I think keying into those programs, I wish there's somebody here. I know Professor Lombin has been at the forefront of the ESAVET training, and it's also geared towards curtailing some of these transboundary diseases. So that it would have been useful to hear their thoughts regarding that. So let me go to Peter. Peter, so what should we do? If you have 2-3 steps to educate us on what do we do going forward? How do we ensure we have collaborations among various sectors so that diseases like this will not be fighting as individuals, but we'll be fighting it collectively as one continent?
Yes, so thank you so much. I really appreciate this program that you have put together. It shows an example of how, proactively, if we are working together, private sector, civil society, government, because there are a lot of, efforts we can put together if we work together. And I think, like I did mention, in Ghana, that collaboration has already started. And I'm glad the veterinary directorate is on this call. Unfortunately, they are not able to speak, but they could have spoken to how that collaboration with the private actors and the civil society is helping with this fight. And it has to be more of this happening across Africa. For instance, the vaccines that we are delivering is delivered by drones. So the zipline is leveraging on drones to make sure that within 2 hours of a request for vaccine, even 1 hour of a request for vaccines, the vaccines are there at the place that is needed. So we already have a lot of resources in private hands that can be leveraged. And I think this is an example of how we are doing it in Ghana. But definitely, collaboration would mean that one has to take a leadership. And if the government is taking leadership, I am very sure that the private actors will come, because that is what we all want. And so I really appreciate what you are doing in Nigeria with your call for actors to come on board. I think we need that across Africa, where there will be an open door policy for everyone to bring in whichever way that they can support, because I think with these kind of bringing different people together, I am sure we will be able to handle some of these diseases even before there's an outbreak.
Peter, we are now on. We have come back to the link, please. Okay.
Okay, Mr. Peter, thank you. I think Dr. Femi is still having challenges with his network, but I'm sure we'll have him back soon. So I'll just continue taking some questions from the comment section, and some thoughts, some are questions, some are comments. Dr. Ishaku Leo Elisha is saying, have we considered the use of calcium oxide during burial of dead animals? That will go a long way as a deterrent for those who might be tempted to exhume the carcass. Okay. All right. Let me see. Okay, Dr. Kayode is back.
Okay, thank you. Probably anyway from the village, right?
Village.
All right. So let's I'll switch to something more stable on my phone. I want to take before those comments on the group, I want to take the director, Veterinary Service Directorate. He's back. I really want us to hear his concluding thought before we conclude this. I see Omileye Ayokunle raising up his hands. We will take you just 1 minute, but I want the Ghana authority to conclude their thoughts. Let's hear them out. Are they on or they are off again? I think it's on. Kingsley Aye. So please, can you kindly unmute him? Let him come up so that we can have him conclude his thought. We built this discussion around what's happening in Ghana. Fantastic. So kindly go ahead, sir. Can you hear us?
Yes, I can hear you. Can you also hear me?
Yes, we can now.
Yes. So as I was saying, we have gone through community sensitization. And now what we want to do is that we are coming out with posters that we are going to distribute at lorry stations, at very vantage points, at schools and everywhere. Presently, because most of the time anthrax is usually confined to the northern sector of the country, we are concentrating all our efforts on the northern sector of the country. That is why it's making it looking like there is no awareness creation. But there's so much awareness creation, just that it might take us some time for it to trickle down. Apart from these things, like I told you before, we have not even had a second meeting with the chief imam. The ED filter is only next week. So we want to make sure that whatever meat is brought from the north to the south, which is the normal practice, we are not going to transport the disease to the south. Fortunately for Ghana, we have got a vaccine production plant that will produce anthrax spore vaccines in Pontamali, which is fortunately also in the north. We have the capacity to produce 100,000 vaccines in a week. Presently, we have 150,000 vaccines that we have earmarked and are there on demand to be shipped to whichever place it will be needed. Then, with collaboration from CowTribe, just like Peter said, CowTribe is helping us with the software that will help us to receive information and disseminate information as fast as possible. We are also using Zipline. To refresh your memory, Zipline is a drone distribution center. So we are using Zipline in the north, and they are now supplying the vaccines directly to the communities. We have assigned community managers who will be responsible for getting all these vaccines, and such that with the bad terrains of our roads, we wouldn't have any problem with traveling with vaccines. The moment the vaccines get there, whoever is in charge picks the vaccines, they go and straight will be in the field. So this is facilitating very fast vaccination processes. Now, let me also say something that heated to this. Sometime in the 80s and before then, anthrax vaccination was routine. It was routine. But due to logistical constraints, we made it a demand-driven activity. We are now going back for anthrax now to be a routine vaccination. When we say routine vaccinations, all we are talking about is that anthrax is going to be such that are going to be basically pains. Anthrax is soil-borne. So when the grass starts growing, that's when the animals pick right from the soil. So that is what we are going to do. And what we have planned to do is that we'll do mass vaccinations in all the 3 northern regions, not only in Upper East region, all the 3 northern regions. In the 5 north, now the present 5 northern regions. We'll do it there, and we've got the capacity to produce the vaccines to meet the demand of those areas. That is what we are planning to do now. Now we are in contact with the minister. The minister is ready to release funds through the Ministry of Finance for us to go and start doing our public awareness. where we'll be on radio, we'll go to schools, we'll bring posters, and there will be advantage points. I'm very happy about the fact that somebody came to Ghana and he's mentioned it. Our biggest problem is now going to be, he mentioned the bushmeat market. All those areas are areas that we are going to do community debates and then sensitize people on the dangers of anthrax. That is what we are doing in Ghana so far. If there are any other questions, you can put to us and we are ready to answer them.
I think that's very impressive. And I'm glad we're able to take your thoughts before folding up this meeting, because we also wanted to know that you're on top of this. And with your comments and the effort you have made, I want to just simply say that you're doing really very well on helping us resolve this. And so far, we know with all this effort put in place and the increased sensitization, coupled with your collaboration with CalTribe, we know you are really on this, and in no time, the situation will be resolved. Once, thank you for joining. I'm going to take Dr. Anzaku. So what I want us to focus on now as final thoughts, because we're out of time, in 10 minutes we should be off this meeting, is, so you want to talk briefly about ISAVET, but more importantly, how do we work together as one entity to resolve this issue, not just in Nigeria, but in West Africa? And if you will, if you have a little more time also, to let us know, how do we prevent so that we are not almost always reactionary? First of all, talk about the ISAVET program and the training and how we can get vets to be at the forefront of vaccinating cattle to prevent some of this disease outbreak. Then secondly, what are the few steps you think or you want to suggest as your final thought to help us work together as one entity in Africa? Dr. Anzako. After you, I'm going to be taking the president of the Veterinary Council, and I will just simply hand over the stage to Dr. Tunsia.
Well, thank you very much, Femi. I just wanted to let you know that actually the in-service applied veterinary epidemiology training program, ISAVET, actually started in Nigeria.
I can't hear you.
You're not hearing me?
Also, we can hear you. I can hear you.
Right. Okay. So I started in 2021, in October precisely. And just like you said, the graduation ceremony for the 4th cohort was done yesterday. And I had the singular honor of representing the CVON at the ceremony. And just to let you know that it's a program that is aimed at strengthening disease surveillance and reporting, basically. And it's a program that is facilitated by FAO, with support of USAID and United UK Global Health Security Agenda, providing the support, financial support. Like I said, we started with government vets, but this last, the 5th cohort that is ongoing in JAWS now has brought on board private veterinarians, those involved in private practice. And the idea is to strengthen disease surveillance and reporting, because we know a lot of the cases are being handled by private vets, including anthrax. And I can assure you that even those who have been trained under the ISAVET program have been charged. They've been integrated into the NAGIS network, where they are going to provide inputs into the system. So that is one. Secondly, I want to say it is we are now transiting from just purely public service to public-private partnership, and all in a bid to strengthen our disease reporting and surveillance in Nigeria. So I want to say with all sense of humility that the ISAVET program that has started about just 2 years or so ago in Nigeria, I think it's one of the major success stories across West Africa and indeed Africa. And well, but you know, Nigeria is a very big country. The department is seeking for ways with FAO on ways of sustaining this program and even expanding it, considering the size of Nigeria. I think that is what I just want the information I wanted to give you on the ISAVET program.
And I want to thank you. ESAVET program, I've followed it up, and I see that it's a very good step in the right direction. So somebody still suggests, I want to hear from Somalia.
Yeah. 6.
IT, if you can quickly help me spotlight the person from Somalia, Bandre. I just want to quickly hear his own perspective. Then I will call on Ayokunle. Then I will talk. I'll call on the president of the Veterinary Council and Peter. Then I will hand over the stage to Dr. Tumsia to just help us round up. I apologize, I might not be able to take or make comments around every of the comments in the chat box, but we can see them and we can respond to them. So the person from Somalia, that's Dr. Abdurrahman. Is he on the call? All right, so if he's not on the call, can we unmute Omileye Ayokunle quickly? You have 1 minute. IT support, can you quickly help us unmute Omileye Ayokunle?
Okay, thank you so much. In Lagos State, we've done a lot of work on influx of ice from all these foreign countries and even North African countries, particularly Cameroon, from Algeria, in fact, as far as Canada, US, all these tanned leather that they destroy, the people bring it in, and it comes through some of these borders too. We, as a state, we have destroyed so many in trailers and buried them. All these things can be source of anthrax. They could be source of anthrax into this country.
All right, so is it his network or my network?
I think it's his network.
Okay, and I will just follow up on. So we are very, Famala has a very excellent relationship with the Lagos state government. I will follow up on that story and get pictures. Perhaps we're going to attach it to our thank you mail, because having government at the forefront of destroying something that could destroy us, it's actually a very good way to go. So Peter, if you have 2 or 3 things to say, 2 or maybe 1 thing because of our time, to say in conclusion, how do we work together as one, not just in Ghana or in Nigeria or in Somalia or in Cameroon, but as West African countries? How do we foster this collective way of interacting and ensure that we are at the forefront of something that could potentially destroy the livestock industry?
Yeah, so thank you so much. I just want to thank the VSD from my country for the excellent inputs on how we are already working as a collaborative in Ghana. I think when you were off, I was still making an input that this is a use case. This is an example of how private sector and public sector can come together to work together in scenarios like this. And we can explore this use case to learn from it and then expand on that. So I really appreciate them sharing the example with you. And I would also want to appreciate, I think the director from your side also mentioned that they are moving from just a public sector focus to a public-private partnership model. And I think in order for us to do this in the scale that will bring some of these diseases down and benefit our farmers, we need policies at the regional level that encourages this public-private partnership, because a lot of these are also not just at the country level, it's also at the regional level. So how do we bring this conversation to the ECOWAS level, to the African Union level, AU, IBA, on how do we integrate public private partnership policies in the way that we handle diseases. I know Dr. Mosi just joined and left, but we have had excellent conversations about how do we encourage this. And BI has been very supportive in Ghana here. So I think people are just on the line waiting to collaborate. And like I said, if the various governments in the various African countries have policies to bring in the private sector, I think that would really, really improve on the collaboration and also allow that innovations to come in for us to be able to fight some of these diseases. So I'm just thankful for all the opportunity to speak today, but definitely there is more that we can do if we start reaching out to each other. Thank you.
Fantastic, and I think today's platform is also a very good way of showcasing that we can together as a nation, people from Ghana, people from Somalia, people from Nigeria, joining and rubbing minds together on one disease. And I think it's an excellent way. Thank you, Peter. I want to take the president of the council. We cannot emphasize more on the need of veterinarians to do the right thing on the field. If you have one last thing to say, Madam President, encouraging veterinarians to do the right thing on the field, what would that be? I just hope she also told me that she's having a busy day because of the newly appointed IG. Okay, I guess she's off. All right, so let me take finally, and then this is final. A good speaker say finally like 3 times, but this is final. Right, I see contributions on the chat. Thank you, just keep them coming. We're going to send the slides and send the recordings of this program to everyone, and then also send how you can access the anthrax vaccines. But let me take the NVRI director as a final step. You have so much data. Everybody reach out to you. Okay, the president is on. Oh, you're on, Askayo Femi. All right, so the president is on. We need to get our input. So look out for Kayode Femi. I gave her my direct link, so that's how she was able to join. And let's make her co-host. Her display picture indicates royalty. So please, IT, can you look out for that and let's hear her talk. Our final. Okay, fantastic.
All right, thank you. Sorry, I just got disconnected somehow, but I've been on throughout. I had to leave the program for this very important interaction. I wouldn't give it up for anything. It's a very wonderful outing, as I said earlier. And our colleagues from Ghana, I think what we need to do, we need to sustain this kind of interface amongst us, not just between Nigeria and Ghana, of course, but within the ECOWAS sub-region. By the time we get strengthened, then we can now expand it further within the African continent. But ECOWAS, we need to have a platform whereby we'll be able to collaborate on issues and so on and so forth. But as I said, kudos to the office, the Federal Ministry of Agriculture and Rural Development through our CVON. They are doing a great job. The NVRI is also up and doing, I think, since Dr. Mrs. Mohammed came on board, it's been one thing or the other, coming up with a lot of new innovations. So I believe our ECOWAS brothers will also benefit immensely from the NVRI in this aspect. There's need for us to have that kind of collaboration, and the CVON also. We will have a lot of wonderful things to do together. One country cannot do it. Now, we say, talking about our border is porous. The ECOWAS protocol is that we have to open borders to our brothers. So we can't just completely close our borders. It's a global world. It's a global village, they said. So I'm sure soon everywhere is open. So within us, we have to. The cattle move anyhow. People move, also migrate from one place to the other. So we can't sit as veterinarians and just watch. And we can start doing that from, as I said, having a forum where we can have all the regulatory agencies working together in harmony to strengthen our regulatory agencies to look at our training programs, to look at our practice, and so on and so forth together. And I'm sure we'll get to the root of it and provide better services for better ECOWAS. I think this is great, Femi. You can extend it further, not just Ghana. See how you can also reach out, because we can start from this forum. I look forward to coming to Ghana. Actually, I'm coming to do something with the Ghanaian police ladies who invited me the last time, and I'm looking forward to coming there and then that time I can take advantage also to have a talk, to initiate a relationship with the Ghanaian, I don't know what they call their own, the Ghanaian veterinary regulatory body. And I think we can do that in unison within us here. There is need to collaborate to strengthen all the agencies, NVMA, Veterinary Council of Nigeria, the Office of the CVON, the NVRI. We need to put our heads together and work as one family, one voice, and then reach out to our brothers within the West African sub-region. We need to do that. Thank you very much. And well done, Farm Alert, for this initiative.
Well, just to also say that we have volunteered to follow you to Ghana, just in case you have an extra seat on the plane. So that
you are welcome, no
we can do this together. Thank you, President Veterinary Council of Nigeria. Now, you can keep your comments ongoing. You might not have the opportunity to say it out, but people are reading the comments and people are responding to them. So keep the comments, keep it coming. And this interaction is both voice and also notes. I want to take the MBRI director finally. Now, one of the key things I notice, especially some of us who handle some of privileged data, sometimes you see data and then you know a particular trend is going somewhere and you are itching to advise people that the data shows otherwise. This is what you need to do. And I want to ask directly to the MVRI director. Everybody comes to you. The government comes to you. Private sector comes to you. Outside the country, if they have issues, they come to you because, as I initially said, you are at the heart of animal health in Africa, if you allow me to put it that way. What is that one advice? There are over almost 300 vets that joined this meeting, and the recordings will be shared. If you have 2 minutes to advise the entire veterinary community, Madam MVRI, Dr. Miriam, what will that advice be?
Thank you very much, Femi. I think the one advice that I would like to give colleagues is to communicate more, to collaborate more. I can see on some of the comments, and it is obvious it's because some of the younger colleagues do not have some of the information that is required. And I think avenues such as this provide us with the platform to be able to communicate, to disseminate the information that we have, and to be able to speak openly so that younger ones understand what the position, how the animal disease control is set up in Nigeria, for instance. The second thing I'd like to correct an impression. The ECOWAS has a regional animal health center. I think we will do well to take advantage of that as an ECOWAS, as a regional community, so that we begin to integrate disease control as a region. As Professor Fashioner said, disease does not understand borders. It crosses so many borders, and it can appear in one country one time, and before you know it, it's in another country. And as I earlier mentioned, we first heard about this anthrax outbreak from Mali, because they had ordered for bulk vaccine from us. And so we began to stockpile the anthrax vaccine because we suspected that it probably spread down. And if I may just use this as for advertisement, we are willing to share and distribute this vaccine across the region. I know some of the countries have their laboratories, but for instance, Ghana is able only to produce 100,000 doses. We are willing to produce the bulk vaccine for them we ship it to them, and they can finish it off and label it as their Ghanaian vaccine, and that will help them to scale up the production and the distribution of the vaccine. Again, just to say that if there is any disease that needs to be controlled either in the region or in Nigeria, MVRI is available, whether on an emergency basis or on a routine basis. We are here, we are willing to collaborate. And again, with the private sector, we're moving. For example, with Farmalert, you know some of the things that we have been talking about. The government has given us the latitude to scale up vaccine production, and we are looking for partners. We are looking for investors so that we can scale up quality vaccine production for Nigeria and for the region. Thank you very much for the opportunity.
Madam ED. So what a very brilliant way to end this conversation. I think one of the things that cut across both is the need to communicate more, to talk more to each other, to collaborate, which is the new way of progress now, and then to have these seemingly borders that stops us from working together broken. And once we can do that, I think the animal health industry will move forward to a very large extent. I want to thank all the hub experts, Professor Pashina, the Dr. Patrick, who is the Director of Veterinary Services Directorate in Ghana. I want to thank Peter Awin. I want to thank the Chief Veterinary Officer of Nigeria, Dr. Vakuru, ably represented by Dr. Anzaku, who has given us very useful insights on the vaccinations they want to embark, and the technical committee that was set up to handle this. I also want to thank the President of the Veterinary Council, Madam Capacity, we usually refer to her as, the Assistant Inspector General of Police, Aishatu Abubakar, for her time, despite her busy schedule, to honor this meeting and be part of it. And then to Dr. Miriam, you were a lot of icing on the cake for us. I was just wondering what was wrong with me, why I didn't extend this advert to you in the first place to have this discussion centered around what it is that you're doing. I think you're doing a lot. And I have a couple of ideas from your last comment on what we can do together, and I'll be reaching out to you personally. From us and everybody who has taken time, unfortunately, we could not take the person from Somalia, but I believe some other continent also joined and we could not acknowledge them. We're going to look at the registration, look at what country you're coming from, and the IT support team will be reaching out to you individually. I want to thank everybody who joined, Dr. Charles, Professor JD Admin, Dr. Tunji Nasiru, Dr. Doshima Kwangi, and everybody I could not really spotlight. And also to thank the Farmalert team for the support they've given to ensure this is done. From me, thank you so much. Dr. Tunsia, over to you.
All right, thank you so much, Dr. Femi, for this amazing moderation, and to everyone who participated. My apologies, we could not take all the questions and comments coming in, but I can see one question, and I think I would love to have it answered before I move on to the rest of the item on the agenda. It's from Dr. Shamsuddin Fagbo, and he's asking, and I think it's a very important question. He's asking, when last was anthrax officially reported in Nigeria? If Dr. Anzaku is still on the call, I don't know if you have preview to that information. So he's asking, when was the last official report of anthrax in Nigeria? Of a confirmed anthrax report in Nigeria? Doctor, I just asked you to unmute so you can speak now.
Yeah, thank you, moderator. Hello?
Yes, I can hear you.
Yeah, please, I think you just do me a favor. Let me not give a very wrong information. I will need to cross-check from our record. But I can assure you that it's been a very long time since we have this confirmed. Yeah, but again, I'll check the record. I'll check the record.
Okay, so this is what we'll do. I would reach out to you personally to get that information. We usually send a thank you message at the end of every session, so I would attach that information, the date, the date, and then where the case was reported, and from which state, and every detail regarding the report. I'll try to get my hands on it and share it with alongside other resources at the end of the session. So thank you, everyone. I think that's how far we can go with the participatory session. So I'll go back to sharing my screen. For those who are just joining, we will go ahead and take our post quiz, which, as I said earlier, for those who are just joining, they are just simple set of questions extracted from the presentation that helps us gain knowledge before and after the presentation. So permit me to launch the post quiz. It will appear on your screen now. 5 questions. We have about 181 participants currently in the room. I implore each and every one of us to engage the question, or the questions rather. Thank you, thank you, thank you. So I'll be quiet for a while to allow you to answer the question. You can also let us know when you're done. Thank you. So I can monitor the engagement rates from my end here. So this is one of the tools we use. Yes, it's coming up. Thank you. We have 5 minutes to take this. And then after 5 minutes, unfortunately, Dr. Fashina had to drop off. He's chairing another webinar. So he had to drop off this call and join the next one. Drop off from this call and join the next one. Yeah. So after this, we'll share the results and quickly run through our responses to see what we have answered. And as I said earlier, none of your data is attached to these responses. All we need is just the response. That's also feel free to engage the questions. Or I think better still, what we'll do is, since Prof is off the call, I will just request he shares the answers to these questions, and I'll also attach it to the thank you email and send it, right? I think that would be the safest and the smartest thing to do. So we're 3 minutes gone, and I'll be taking down the poll quiz shortly. Let me see what we have in the chat box. A lot of Omolola, Dr. Omolola is done. Dr. Adam, Dr. Blessing, Awe, not accessible from my end. I wonder why. Let's see if there's anything. The IT support team, is there anything you can do to help Dr. Blessing Awe? She cannot see the screen from her end. Dr. Zainab Dambazao, done. Well done. Dr. Tanimo Joseph, done. Well done, well done. Dr. Hainaya Bitrus. Thank you, Dr. Amaye Gusi. Dr. Mariam Habib, well done. Dr. Husseini Abubakar, Dr. Leonard, Dr. Damilari. I think people, I don't know why Dr. Daniel David and Dr. John cannot see the quiz, and we have Dr. Idrisa also complaining about not seeing the screen. So let's see if there's anything the IT team can do. Though we're running out of time. We have 63% engagement. We're 4 minutes gone, so we have just 1 more minute to go. I will take down the post quiz and take down the polls and take a few announcements, and we can call it a day. Thank you once again for staying. We have about 164 people in the room. Still a good engagement rate, if you ask me. So we have just about 10 seconds to go, and I will end the poll and then move forward with other announcements. All right, 52 seconds. All right, I will end the poll now. 68% engagement. That wasn't bad. Well done, everyone. So I would thank you so much, everyone, for engaging the post quiz, and to everyone who attended. Thank you once again. And I would like to say a very big thank you to our hub expert, Professor Folorunsho Fashina, the President of the Veterinary Council, AIG Aisha Tubaju, the Chief Veterinary Officer of Nigeria, in person of Dr. C. Bakuru, ably represented by Dr. Azaku. We have the Director of the Veterinary Service Directorate of Ghana, in person of Dr. Patrick Abake. Thank you for sparing our time. We have CEO and co-founder of CowThrive, Peter Arwin, and of course, Dr. Maria Mohammed, who is the Executive Director of the Nigerian Veterinary Research Institute of Nigeria. Thank you so much, Ma, for being on this call with us. To Dr. Olatunji Nasir, Dr. Charles Ibe, and every other senior colleague and every other not so senior colleague in the room. Thank you so much for joining. I'm glad that we're able to come together. And later today, there is another session organized by the Federal Ministry of Agriculture and Rural Development, the Veterinary Service Department. So I think it's by 3 p.m. So we'll try as much as possible to see how we can also get more people to join so we can continue the conversation from there. So we now serve as a private continuing education provider to the Veterinary Council of Nigeria. So what this means is that FarmAlert is a certified continuous professional development provider. So these TechClass sessions are for free. Anyone can attend, right? But if a token of 2,750 Naira is needed to have your VCN accredited certificate and your name submitted for your CE point. So what this means is that you pay this amount of money, you'll get a certificate, an accredited certificate from FarmAlert, an accredited certificate by VCN from FarmAlert, and then FarmAlert will submit your name to the Veterinary Council of Nigeria to award points accordingly. So technically our sessions are 1 hour, and by the rules of the council, it's 1 hour. Technically it's 1 point per hour. So these are steps. You make payment into the FarmAlert account, ECHO account, 790. Dr. Bale, you can type out this in the chat box. 79010492235 Providence Bank. So what you will do is after paying, you send a message to Dr. Tunsia on 0813863446 for verification and for your certificate. So once you make payment, you send your proof of payment, your VCN number, and how you want your name to appear on the certificate. However, you could, you can get this information later today, because we also send an attendance sheet for you to confirm the duration you stayed in the session. You're only eligible if you have spent 30 minutes and above in the session. So anyone who has spent less than 30 minutes is not eligible to get this certificate. So you will get a thank you email later today containing resources from this presentation and also steps on how to make payment for your certificate. Thank you so much. So you'll get this details by the end of the day, today. So if there are other topics you want us to address, I have my backup team extracting this information, kindly drop it in the chat box. If there are other topics you want us to address on this platform, would use your suggestions to inform decisions for our next sessions. Thank you so much, everyone. Make sure you follow us on all our social media platforms, YouTube, LinkedIn, Facebook, Instagram. You simply just type Farmalert and we're right there, so you stay updated with all of our activities and recent updates. To everyone who joined in today, thank you once again. I am Dr. Tumsia Maimuna Man Isa, the Community Engagement Manager for Farmalert. And yes, we're open to collaborations, right? So you can reach out to me via the contact number or via my email address, or you can reply the email that sends you that the email that would send you these resources, and we can pick up the discussion from that end. To all the stakeholders involved, well done, thank you, and I hope we're able to put all our words into action. Thank you and stay blessed, everyone.